topic today will be on tubal blockage, that is blocked fallopian tube, and how it can affect your fertility, the symptoms, the causes, and the treatment options. Fallopian tubes are part of the female reproductive organ. Every woman of reproductive age is supposed to have two fallopian tubes, one located on each side of the ovary. It is a pathway through which the uterus connects to the ovary. When you release an egg during ovulation as a woman, that egg is supposed to travel through the fallopian tube, fertilize within the fallopian tube, and get implanted within the endometrium, that's the uterus. When sperm is being introduced into a woman, that sperm is supposed to travel through the cervix to the uterus, and then it will get to the fallopian tube where it's supposed to unite with that egg for fertilization to occur. After fertilization, the egg is supposed to travel back to through the same fallopian tube. It will travel to the uterus for implantation to take place. Now, if there is blockage within the tubes, that the sperm could not get to the egg for fertilization, or after fertilization that the egg could not get back to the uterus for implantation to take place, it may affect your fertility life. Tubal blockage is a common cause of infertility because when both of them do not unite, it means fertilization will not occur. And then pregnancy, conception without treatment this time will be impossible. But if that blockage is partial, if it's partial blockage, pregnancy may occur, but then the risk of ectopic pregnancy will be increased. This is because is harder for a fertilized egg to travel through a blockage. It may get stuck within the block, it may get stuck within the uterus, within the tubes. And once this happens, it will start developing that place, and this will give rise to ectopic pregnancy. And in this case, your doctor may recommend IVF, that's in vitro fertilization, depending on whether treatment is possible. Then if the blockage is within one tube, remember we have two tubes. If one is blocked and one is open, it means that conception is possible, pregnancy is possible, but then you may be needing some drugs that will help you to ovulate more on the other side that is open. So it depends. Your conception, your chances of getting pregnant with tubal blockage depends on one, if it's complete. If it's complete, then you need treatment for you to conceive. If it's partial, you may conceive. If it's partial blockage, you may conceive, but the risk of ectopic pregnancy will be increased. Then if it's one tube that is blocked, then you can ovulate. You can ovulate, get fertilized with the other tube. You can conceive with the other tube. Now, symptoms of a tubal blockage. Most time, this tubal blockage doesn't cause any symptoms. You may not notice anything. But in some cases, blockage of the tube can lead to mild or regular pain on one side of the abdomen, the lower abdomen, and this will occur when there is a hydrosalpinx. When there is a kind of blockage that is called hydrosalpinx, which is when fluid gets accumulated within one of the tubes and enlarge. When there is blockage, fluid will be accumulated within one of the tubes and it will get enlarged. And in that case, you will be having mild lower abdominal pain, and it will always be regular in a particular side of the uterus.